Let's see an NCLEX RN video based on the physical assessment of the neonatal client. A full-term neonate is admitted to the normal newborn nursery. The nurse notes a Moro reflex. What should the nurse do next? Call a cord, identify this reflex as a normal finding, place the neonate on seizure precautions, start supplemental oxygen. The Moro reflex is a normal reflex of a neonate and it requires no intervention. Calling a cord, placing the neonate on seizure precautions and starting supplemental oxygen, they are not necessary for a normally occurring reflex. After the delivery of a neonate, a quick assessment is completed. The neonate is found to be apneic. After quickly drying the neonate, what should the nurse do next? Assign the first Apgar score, place the head in a sniff position, administer oxygen, start cardiac compressions. When resuscitating the neonate, the principle of airway breathing circulation must be followed. Positioning the neonate on the back with the neck slightly extended in the sniffing position will open the airway, allowing oxygen to get to the neonate's lungs. Apgar scores are an evaluation of the neonate's status at 1 and 5 minutes of life. Waiting to open the airway until after assigning an Apgar score would be a waste of valuable time. If the airway is not patent, oxygen cannot be delivered. Cardiac compression must be accompanied by adequate oxygenation. A 6 lb 8 ounce neonate was delivered vaginally at 38 weeks gestation. At 5 minutes of life, the neonate has the following signs: heart rate 110, intermittent grunting with respiratory rate of 70, flaccid tone, no response to stimulus, overall pale white in color. The Apgar score is 2, 3, 4, 6. The neonate has a heart rate of 100, so earns 2 points. Respiratory rate is 70, that is equivalent to a 2 on the scale. His flaccid muscle tone is equal to 0 on the scale. The lack of response to stimuli also equals 0, as does this overall pale white color. So thus a total of 2 plus 2, that is 1 for heart rate and 1 for respiratory rate. 2 plus 2, 4 we can give to this child. A neonate has a large amount of secretions. After vigorously suctioning the neonate, the nurse should assess for what possible result: bradycardia, rapid eye movement, seizures, tachycardia. As a result of the vigorous suctioning, the nurse must watch for bradycardia due to potential vagus nerve stimulation. Rapid eye movement is not associated with vagus nerve stimulation. Vagus nerve stimulation will not cause seizures or tachycardia. When reviewing the prenatal history for a newly delivered neonate, the nurse notes that the mother has neurofibromatosis. The nurse should further assess the neonate for acrocyanosis, caffeolate spots, port vein nevus, strawberry hemangiomas. There is a correlation between caffeolate spots and the development of neurofibromatosis. Acrocyanosis is a normal finding of bluish hands and feet as a result of poor capillary perfusion. Port vein nevus and strawberry hemangiomas are a collection of dilated capillaries and are not associated with any other disease process. A 24-hour-old full-term neonate is showing signs of possible sepsis. The nurse is assisting the physician with a lumbar puncture on this neonate. What should the nurse do to assist in this procedure? Select all that apply. Administer the IV antibiotics, hold the neonate steady in the correct position, ensure a patent airway, maintain a sterile field, obtain a serum glucose level. So, holding the neonate steady and in proper position will help ensure a safe and accurate lumbar puncture. The neonate is usually held in a C position to open the spaces between the vertebral column. This position puts the neonate at risk for airway obstruction, thus ensuring the patency of airway is the next priority. And the nurse should observe the neonate for adequate ventilation. Maintaining a sterile field is also important to avoid infection in the neonate. It is not necessary to administer antibiotics or obtain a serum glucose level during this procedure. After a vaginal delivery of a term neonate, the nurse observes that the neonate has one artery and one vein in the umbilical cord. The nurse notifies the pediatrician based on the analysis that this may be indicative of respiratory anomalies, musculoskeletal anomalies, cardiovascular anomalies, facial anomalies. Normally, the umbilical cord has two umbilical arteries and one vein. When a neonate is born with only one artery and one vein, the nurse should notify the physician for further evaluation of cardiac anomalies. Other common congenital problems associated with the missing artery include renal anomalies, central nervous system lesions, tracheoesophageal fistulas, trisomy 13 and trisomy 18. Respiratory anomalies are associated with dyspnea and respiratory distress. Musculoskeletal anomalies include fractures or dislocated hip, and facial anomalies are associated with fetal alcohol syndrome or Down syndrome, not a missing umbilical artery. So here it is cardiovascular anomalies. Shortly after birth, the nurse measures the circumference of her term neonate's head and chest. When the two measurements are compared, which of the following would the nurse expect to find about the head circumference? Equal to the chest circumference, approximately 2 cm larger than the chest, about 3 cm smaller than the chest, approximately 4 cm larger than the chest. Normally at birth, the neonate's head circumference is approximately 2 centimeters larger than the chest circumference. The average normal head circumference is 33 to 35 centimeter and average normal chest circumference is 31 to 35 centimeter. 33 centimeter. A head circumference that is equal to or smaller than the chest circumference that may indicate microcephaly. A head that is larger than normal may indicate hydrocephalus. The presence of any other conditions warrant further evaluation. After explaining to a primiparous client about the causes of her neonate's cranial molding, which of the following statements by the mother indicates the need for further instruction? The molding was caused by an overlapping of the baby's cranial bones during my labor. The amount of molding is related to the amount and length of pressure on the head. The molding will usually disappear in a couple of days. Brain damage may occur if the molding doesn't resolve quickly. The mother needs further instruction if she says that the molding can result in brain damage. Brain damage is highly unlikely. Molding occurs during vaginal delivery when the cranial bones tend to override or overlap as the head accommodates to the size of the mother's birth canal. The amount and duration of the pressure on the head influence the degree of molding. Molding usually disappears in a few days without any special attention. Initial assessment of a term female neonate. about 4 hours old, reveals a normal anterior fontanelle. The nurse documents its shape as which of the following? Oval, square, diamond-shaped, triangular. So here the anterior fontanelle is normally diamond-shaped, approximately 2 to 3 cm wide and 3 to 4 cm long. This allows for brain growth during the early months of life. The posterior fontanelle is small and triangular. Which of the following observations is expected when the nurse is assessing the gestational age of a neonate delivered at term? Ear lying flat against the head, absence of rugae in the scrotum, salt creases covering the entire foot, square Ventosine angle of 90 degrees. Salt creases covering the entire foot are indicative of a term neonate. If the neonate's ear is lying flat against the head, the neonate is most likely preterm. An absence of rugae in the scrotum typically suggests a preterm neonate. A square Ventosine angle of 0 degrees occurs in neonates of 40 to 42 weeks of gestation. A 90-degree square window angle suggests an immature neonate of approximately 28 to 30 weeks gestation. While performing a complete assessment of a term neonate, which of the following findings would alert the nurse to notify the pediatrician? Red reflex in the eyes, expiratory grunt, respiratory rate of 45 breaths per minute, prominent xiphoid process. An expiratory grunt is significant and should be reported promptly because it may indicate respiratory distress and the need for further intervention such as oxygen or resuscitation efforts. The presence of red reflex in the eyes, it is normal, and absent red reflex, it may indicate congenital cataracts. A respiratory rate of 45 breaths per minute and a prominent xiphoid process are normal findings in a term neonate. After instructing a mother about normal reflexes of the term neonate, the nurse determines that the mother understands the instructions when she describes the tonic neck reflex as occurring when the neonate does which of the following? Steps briskly when held upright near a firm hard surface, pulls both arms and does not move the chin beyond the point of the elbows, turns head to the left, extends left extremities and flexes the right extremities, extends and abducts the arms and legs with the toes fanning open. The tonic neck reflex, also called the fencing position, is present when the neonate turns the head to the left side, extends the left extremities and flexes the right extremities. So this reflex disappears in a matter of months as the neonatal nervous system matures. The stepping reflex is demonstrated when the infant is held upright near a hard, firm surface. The prawn crawl reflex is demonstrated when the infant pulls down both arms but does not move the chin beyond the elbows. When the infant extends and abducts the arms and legs with the toes fanning open, this is a normal Babinski reflex. A primiparous client expresses concern asking the nurse why her neonate's eyes are crossed. Which of the following would the nurse include when teaching the mother about neonatal strabismus? The neonate's eyes are unable to focus on light at this time. Neonates commonly lack eye muscle coordination. Congenital cataracts may be present. The neonate is able to fixate on distant objects immediately. Convergent strabismus is common during infancy until about age 6 months because of the poor oculomotor coordination. The neonate has peripheral vision and can fixate on close objects for short periods. The neonate can also perceive colors, shapes, and phases. Neonates can focus on light and should blink or close their eyes in response to light. However, this is not associated with strabismus. An absent red reflex or white areas over the pupils, not strabismus, it may indicate congenital cataract. Most neonates cannot focus well or accommodate for distance immediately after birth. So here the nurse need to teach neonates commonly lack eye muscle coordination. While performing a physical assessment on a term neonate shortly after birth, which of the following would cause the nurse to notify the pediatrician? Deep creases across the soles of feet, frequent sneezing during the assessment, single crease on each of the palms, absence of lanugo on the skin. A single crease across the palm, which is known as a simian crease, is most commonly associated with chromosomal abnormality, notably Down syndrome. Deep creases across the soles of the feet is a normal finding in a term neonate. Frequent sneezing in a term neonate is normal. This occurs because the neonate is a nose breather and sneezing helps to clear the nares. An absence of lanugo on the skin of a term neonate is a normal finding. Metabolic screening of the infant revealed a high phenylketonuria level. The following statements by the infant's mother indicates understanding of the disease and its management. Select all that apply. My baby can't have milk-based formulas. My baby will grow out of this by age of 2. This is a hereditary disease, so any future children will have it too. My baby will eventually become retarded because of this disease. We have to follow a strict phenylalanine diet. A dietitian can help me plan a diet that keeps a safe phenylalanine level but lets my baby grow. Phenylketonuria, it is an inherited autosomal recessive disorder, involves the body's inability to metabolize the amino acid phenylalanine. A diet low in phenylalanine must be followed. Such foods as meats, eggs and milk are high in phenylalanine. Assistance from a dietitian is commonly necessary to keep phenylalanine levels low and to provide the essential amino acid necessary for cell function and tissue growth. With autosomal recessive disorders, future children will have a 25% chance of having the disease, a 50% chance of carrying the disease, and a 25% chance of being free from the disease. If the diet low in phenylalanine is followed until brain growth is complete, maybe sometimes in adolescence, the child should achieve normal intelligence. So here the first option, my babies can't have milk-based formulas. The fifth option, we have to follow a strict phenylalanine diet. And the last one, dietitian can help plan a diet that keeps a safe phenylalanine level but lets my baby grow are the correct. Assessment of a term neonate at 2 hours after birth reveals a heart rate of 110 beats per minute, periods of apnea approximately 25 to 30 seconds in length, and mild cyanosis around the mouth. The nurse notifies the pediatrician based on the interpretation that these findings may lead to which condition? Respiratory arrest, bronchial pneumonia, intraventricular hemorrhage, epiglottitis. Periods of apnea lasting longer than 20 seconds, mild cyanosis and a heart rate of 110 beats per minute, that is bradycardia, are associated with a potentially life-threatening event and subsequent respiratory arrest. The neonate needs further evaluation by the pediatrician. Pneumonia is associated with tachycardia, anorexia, malaise, cyanosis, diminished breath sounds and crackles. Intraventricular hemorrhage is associated with prematurity. Assessment findings include bulging fontanelles and seizures. Epiglottitis is a bacterial form of croup. Assessment findings include inspiratory stridor, cough, and irritability. It occurs most commonly in children aged 3 to 7 years. A new mother asks, when will the soft spot near the front of my baby's head close? The nurse should tell the mother the soft spot will close in about 2 to 3 months, 6 to 8 months, 9 to 10 months, and 12 to 18 months. Normally, the anterior fontanelle closes between ages 12 and 18 months. Premature closure, that is craniostenosis or premature synostosis, prevents further or proper growth and expansion of the brain, resulting in mental retardation. The posterior fontanelle typically closes by ages 2 to 3 months. Which of the following assessment findings in a term neonate would cause the nurse to notify the pediatrician? Absence of tears, unequally sized corneas, pupillary constriction to bright light, red circle on pupils with ophthalmoscopic examination. So, the corneas of unequal size should be reported because this may indicate congenital glaucoma. An absence of tears is common because the neonate's lacrimal glands are not yet functioning. The neonate's pupils normally constrict when a bright light is focused on them. The findings implies that light perception and visual acuity are present as they should be at after birth. A red reflex or red circle on the pupil is seen when an ophthalmos light shines into the retina, and it is a normal finding. It is called a red reflex. This indicates that the light is shining onto the retina. At 24 hours of age, assessment of the neonate reveals the following: eyes closed, skin pink, no sign of eye movements, heart rate of 120 beats per minute, and respiratory rate of 35 breaths per minute. The nurse interprets these findings as indicating that this neonate is most likely experiencing which of the following: drug withdrawal, first period of reactivity, a state of deep sleep, respiratory distress. At 24 hours of age, the neonate is probably in a state of deep sleep, as evidenced by the closed eyes, lack of eye movement, normal skin color, normal heart rate, and respiratory rate. Jitteriness, a high-pitched cry, and tremors are associated with drug withdrawal. The first period of reactivity occurs in the first 30 minutes after birth, evidenced by alertness, sucking sounds, and rapid heart rate and respiratory rate. There is no evidence to suggest respiratory distress because the neonate's respiratory rate of 35 breaths per minute is normal. So here the child is in a state of deep sleep. While assessing a male neonate whose mother desires him to be circumcised, the nurse observes that the neonate's urinary meatus appears to be located on the ventral surface of the penis. The physician is notified because the nurse suspects which of the following: phimosis, hydrocele, epispadiasis, and hypospadias. The condition in which the urinary meatus is located on the ventral surface of the penis, it is termed hypospadias, occurs in 1 of every 500 male infants. Circumcision is delayed until the condition is corrected surgically, usually between 6 and 12 months of age. Phimosis is an inability to retract the prepuce at an age when it should be retractable or by the age of 3 years. Phimosis may necessitate circumcision or surgical intervention. Hydrocele is a painless swelling of the scrotum that is common in neonates. It is not a contraindication for circumcision. Epispadiasis occurs when the urinary meatus is located on the dorsal surface of the penis. It is extremely rare and is commonly associated with bladder exstrophy. Hope you understood this video. Keep watching for further videos. Thank you.